Great. So I'm happy to talk with you all today about some of the most common migraine myths that we'll encounter. You may hear myths like this from out in the community, from family members, or you yourself or your family members may believe some of these things. And so my hope is that we can learn a lot more about migraine, and then therefore you can be empowered to go out and educate those around you about more about your migraine. So that everyone can be a little bit more educated about what's going on. So we'll start with the most common myth, I think, that people think is migraine is just a really bad headache. All of you here have migraine, so you know this is not true. Migraine is not just a headache. It presents with more symptoms than just a headache, and we'll discuss that on the next slide. But it's also a major cause of disability. It ranks second worldwide among all diseases with respect to years of life lived with disability. So the difference between a migraine and a headache is that headaches can be a symptom of any illness. That could be strep throat, a viral illness, but migraine itself is the illness. That is what's the cause of your symptoms. And so migraine not only occurs with a headache, but also other symptoms. And this is not an all-inclusive list, but light sensitivity, sound sensitivity, and smell sensitivity are very common symptoms associated with migraine. Nausea with or without vomiting can occur. Some people with their migraine will have what's called an aura, which is some sort of neurologic symptom, whether that be spots in the vision, weird numbness or tingling throughout the body that goes before the headache part starts, and then it goes away once that starts, and then you get your typical migraine symptoms. So that's called an aura. You don't get that with just a regular headache. Vertigo can occur with migraine. So that's the sensation that the room is spinning, or that you're spinning, or some people even describe that it feels like rocking on a boat. Also associated with migraine, ringing in the ears. People will feel a vague sense of dizziness, and dizziness means different things to different people, but that's a commonly reported symptom. Fatigue, very commonly associated with migraine. Insomnia, difficulty falling asleep, that includes difficulty staying asleep. A lot of people also report neck pain as a part of their migraine. And these are just the most common symptoms. There are many, many other symptoms that are also associated. So you can see from this alone, these symptoms alone, that migraine is far more than just a headache. Myth number 2, it is my fault that I have migraine. I think a lot of patients believe that, and sometimes that can be perpetuated by providers in a well-meaning way. Migraine, we know, is a genetic neurologic condition, and you didn't do anything to cause your migraine. There's something about you that just makes you more prone to having these sort of migraine symptoms, just like there is another person who may be something about them makes them more likely to have asthma. So it's not that you did anything to cause it. There can be triggers that make it worse, but the underlying cause is not your fault. So keeping a headache diary can help you identify the triggers of your migraine, but you always know that those triggers are not the underlying cause. Like we said before, the migraine is the illness. And so there are certain things that can make it worse. Stress can be a trigger, and it's probably one of the most common triggers. And so we do our best to manage our stress, but it's impossible to manage all stress because these things vary so much from season to season, from year to year, from month to month. And so avoiding stress alone isn't going to stop your migraines from happening completely. And it's important to know that many triggers just can't be avoided. And so it's a lot more than these triggers or stress that are the cause. It's definitely a genetic neurologic condition. Myth number 3, only adults get migraine. All of you here obviously know that this isn't true, but you may hear that out in the community. And it's probably a big reason why a lot of the times kids can go a longer time undiagnosed, and the first time that they hear or get a migraine diagnosis is in adulthood. So if you're here, luckily you are able to find out that you have migraine now, which is great. children as young as 6 years old can be diagnosed with migraine. In younger children, it can get missed because oftentimes the headache isn't the worst symptoms. It's usually abdominal pain or vomiting that's a lot worse. And the headache is milder, so it doesn't really get addressed. Also, in younger children, it can just be harder to verbalize that they're feeling a headache. There are precursors to migraine or other things that we say are on the spectrum of migraine. Abdominal migraine is one, and cyclic vomiting syndrome is another. And so those usually present younger. And then as kids hit adolescence and puberty, migraine becomes a lot more obvious. But we know that there's a spectrum there that starts as early as 6 years old. Myth number 4, migraine is a psychological condition. So migraine is a very complex neurobiological disorder. So it does cause physical changes in the body. What we know is there is an association with mood disorders and other psychological disorders. So 30% of people who do have migraine also have a mood disorder. It doesn't mean that that's necessarily the underlying cause, because again, we stated earlier that the migraine is the illness. Mood disorders often associated with the migraine there could be some of the same kind of genetic and biological factors contributing to those as well. We also know about pain is that it can lead to cycles of stress, depression, anxiety, and then more pain. And then it just becomes an endless cycle. So we do think it's very important to also address the psychological component of the pain that you're having. And that's why in our clinic, we work with Dr. Wright, who is a pain psychologist, as mentioned before, because it is one of the most important parts of managing your migraine headaches is getting those things under control, even though they're not the underlying cause. Myth number 5, migraines have a distinct cause. So there's not just one factor, as we kind of mentioned before. A lot of times patients or families will come into clinic and they'll say, well, what's the cause of the migraine? We've tried everything and she's still having migraine. He's still having migraine. What's the underlying cause? Is there something going on? And so it's very important to understand that migraine is what you're dealing with, and managing it is going to require multiple different approaches to get it under control. But you're not going to find a cause or a reason for migraine. There are so many different variables that go into causing them. And so you kind of, each person is individual, and there's a little bit of difference in, what medications are going to work for what person, what triggers are going to be worse for one person. And so the treatment is very unique to each individual. There's not one cause for the migraine. Myth number 6, I can't have migraine because no one else in my family has migraine. That's actually a really good thought that makes sense, because we hear that migraine is genetic. And when we think of something that's genetic, we think of something that I got from mom or dad. And so genetics is a lot more complex than that. There are things that are inherited, really straightforward. Mom has it or dad has it, and then therefore you're going to have it. But there are so many other factors that play a role in genetics. And so it is possible to have parents that don't have migraine and you're the only one. Most likely, though, family members have had migraine. They're not as severe. They're more easily treated, so they've never been diagnosed, or they've been misdiagnosed with sinus headaches, stress headaches, allergy headaches. And so sometimes we just have to dig a little bit deeper into the family history to say, maybe there are some family members that have them, they've never been diagnosed, or they've been misdiagnosed. We find that in a lot of people who think they don't have a family history of migraine. Ask a couple or more questions. Myth number 7, there is a diet plan that will cure migraine. If you look online, there are plenty of diets that people have spoken about that work for them individually. So in general, all we can recommend is a really healthy diet, drinking lots of water, avoiding processed foods, fatty foods, fried foods, and focusing on foods that are really high in fiber and nutrients, so lots of fruits and vegetables. If you know of any of your food triggers, which I think I have listed on the next slide, you'll want to avoid those. But some people will swear that a ketogenic diet helped them. Some people will swear that a vegan diet helped them. Some people will swear that an Atkins diet helped them. That could be true. All of those diets can be helpful, but usually it's because they're avoiding a lot of those bad foods in the diet anyway. And so in general, you can play around and see what kind of diet works best for you. With nutrition, it's so individual and it varies so much. So there's not one diet that's definitely going to treat your migraine, but you may find that you make certain dietary changes and you get a significant improvement. And so there's just a list of the most common triggers. Now, I don't recommend that you see a list like this and you just go ahead and eliminate all of those things, because it's not necessary. It's more helpful to keep a headache diary and pay attention to how you feel when you eat certain foods. You can keep in mind that some of these foods are triggers and pay attention to what happens. The best thing to do is usually eliminate one thing at a time to see what happens. If you can do that in conjunction with a nutritionist, that is ideal. Myth number 8, there's a blood test or imaging study that will diagnose migraine. So migraine is a clinical diagnosis. There's actually no test that will say you have migraine. The way we diagnose migraine is by listening to you. You tell your physician, you tell your provider, I have these symptoms. I have headache, I have a throbbing, pulsating headache, I have light sound sensitivity. And you tell them a certain number of symptoms that we're looking for. You meet criteria when you have those symptoms present for a certain amount of time, and that's how you diagnose migraine. Now, the reason to do blood tests would be if there are other things that sound like it is not migraine in the history that you give your provider. And in those instances, sometimes specific blood tests or imaging like a CT or an MRI will be done, because there's a concern that this may be something other than migraine. But if you give a very straightforward history that sounds like a classic migraine, you're not likely going to get any further tests from there. You'll move on to going ahead and just treating those symptoms. And so some of the symptoms that we look for include a description of the headache. So if it just happens all of a sudden, within like a minute, you get the worst headache of your life, that would be concerning. If you have a headache and any other kind of physical objective symptoms that we can see on our exam, you'll most likely get some imaging. If your headache has a postural component to it, so if it's worse from laying down to sitting up or vice versa, sometimes that's an indication to get imaging. And really, this isn't an exhaustive list, but this is some things that make us go, do we need to do further evaluation? It will vary from person to person. And myth number 9, there's nothing outside of medication I can do to prevent or manage my migraine. This we know is not true. It's actually best to use other methods than just medications to manage migraine. Medications are helpful and they are good, but they're just one part of what can be helpful. And you're going to have your best chance of living pain-free or with less disability when you approach it in a lot of different ways outside of medication. And so good lifestyle habits, like we talked about before, avoiding triggers, which I said probably on every slide. Sometimes it's necessary to do things like therapy. There's a specific therapy like cognitive behavioral therapy, biofeedback that we use. Yoga or mindfulness can be helpful, and there are apps that can help with that. Some people will use acupuncture. Physical therapy can be helpful, especially if you have a lot of tension here in your neck. Massage therapy for the same reason. There are supplements that we use oftentimes in migraine treatment, most commonly in kids. You may be prescribed magnesium or riboflavin. We use those a lot. And then there are also devices, and I didn't list, but injections too that can be used. But there are wearable devices. One is called a cephaly. We like to use that one in our clinic that you can wear. We call those neuromodulation devices that you can wear for a prescribed amount of time instead of just taking a medication or in addition to just taking a medication. And so as you can see, there are several different ways that we can get you feeling a lot better outside of medication. And then myth number 10, migraine is something I just have to live with. So obviously there's no cure. There's no cure for migraine, but research is being done regularly and new treatments are coming out all the time. And so hopefully there will be a cure one day, but there's definitely, it's not something you just have to live with. We always keep trying new things. It's important to keep communicating with your physician, your provider, how things are going, if things are not working, if things could be better, if things have worsened, if you don't like some of the side effects of medication. It's important to kind of set goals for what you want, and then you with your provider and your relationship helping you get there and get you feeling better. So I always say don't give up hope. It can be a long road depending on where you're starting with your migraine, but the first step is getting on that road to getting better. And once you're there, we just keep trying and we don't give up. So I always say there's always something that we can do to help you feel better. And I think that's it. So don't be shy if there are any questions. I don't know if anything came up on the chat box, but if there are any questions or concerns, I would be happy to answer or clarify.
Thank you so much, Dr. Forte.
No problem.
And yes, you are welcome to use the chat, or you can go ahead and unmute yourself if you have a question. And you can always feel free to do that now or after Dr. Wright's presentation as well. And nothing